welcome to Askimo TV. We're talking today to Martin Samuel. Martin is a speech and language therapist specializing in adult acquired and degenerative neurological conditions and teenage and adult stammering. Hi Martin, how are you?
Morning, Joanne. I'm very well.
Great. Wonderful to be talking to you today, Martin. Martin, we're going to be having a discussion today around stuttering and adults. What is stuttering? What causes stuttering? But let's begin with, what is stuttering?
Okay. First of all, stuttering and stammering, these are really different names for the same difficulty. In the UK, we generally use stammering, and certainly in Australia and in the United States, they generally use stuttering. Stammering is really a disorder of fluency. It is an involuntary repetition, prolongation, or a block which interrupts the normal speech flow. Generally, the speaker finds it difficulty saying what they want to say in a controlled way. It is not present all the time, and it is not present in all situations. I myself have a stammer and have had one since I was a very young child.
What causes the stuttering?
The cause of developmental stammering or stuttering from birth is really unknown, and there have been some studies which suggest a genetic cause, and there also are some familial links as well as some learned behaviours. With acquired stammering, they are often caused by trauma to the head, e.g. strokes.
How do you diagnose stuttering in adults? And are there different types of stuttering in adults?
So diagnosis of stammering is really done by informal assessments, by observation, and by taking a detailed case history with the patient. Generally, there are patterns of disfluencies or stammering. Some people may have problems with silent blocks, with prolongations, which are where a sound is prolonged, such as Martin. You can have repetitions, such as m, or you can have facial grimacing, where really the position of the lips and the tongue is in the incorrect position for a sound that needs to be said. But with most people, what we generally find is that it's a combination of these factors.
How would you treat someone who is a stutterer?
Treating an adult with a stammer requires a speech therapist to understand the current strategies and techniques that the person is using at present. It is likely that they will be using some strategies that they have learnt over many years, and it's likely that these are probably ultimately unhelpful in trying to manage the stammer successfully. The therapist will over time highlight these areas and advise on strategies to prevent their continued use. The speech therapist will also introduce techniques and tips to help the person to say the specific sounds more easily. This may involve working on certain sounds, lip and tongue positions, maybe breathing, pacing, and also some management of the person's anxieties. It is important that treatment confronts the stammer and does not allow continued avoidance. This can take time and is not always easy.
If a person has stuttered since childhood and comes to you as an adult for treatment, is it possible to help somebody after such a long time?
Most children who stammer do not continue to stammer into adulthood if they receive appropriate treatment when they are young. However, some adults do continue to stammer, and there are ways that a speech therapist can generally help. It may be that therapy techniques are now more appropriate, or it may be that the person responds to treatment more effectively as an adult. So there is always something that can be done to help somebody with a stammer.
What tips do you have for helping people who are trying to communicate with an adult who is stammering?
The best advice I can give is to really make sure that the person has sufficient time and that you don't try and finish their words or sentences for them, as most people who stammer generally don't like this. Really, we would want people to try to interact with a person who stammers in the same way as you would interact with any other person. And if the person wants to speak about their stammer, then do so in a listening, non-judgmental way.
Thank you, Martin. Thank you so much for talking to me today.
You're welcome. Thank you.